Welcome to our discussion on a topic that affects millions of people worldwide, obstructive sleep apnea, or OSA for short. If you're not familiar with the term, OSA is a common sleep disorder characterized by repeated interruptions in breathing during sleep. These interruptions occur when the muscles in the back of the throat fail to keep the airway open, despite efforts to breathe. The symptoms: frequent pauses in breathing while asleep, loud snoring, and restless sleep. Waking up feeling unrefreshed, daytime sleepiness, and morning headaches are also common. But it's more than just a poor night's sleep. OSA can significantly impact a person's health, leading to conditions like heart disease, stroke, and even mental health issues. According to the World Health Organization, it's estimated that nearly 1 billion people globally could be affected by OSA. That's a staggering number, isn't it? Given the prevalence and serious health consequences of OSA, effective treatment is crucial. Currently, the primary treatment for OSA is a device known as a continuous positive airway pressure or Cpap machine. But it's not without its challenges. In the next scene, we will delve deeper into the current state of OSA treatment and the exciting prospect of a revolutionary medicinal approach that could change everything. So stay with us as we explore this compelling topic. What if the current state of obstructive sleep apnea, OSA treatment, could be dramatically improved with a simple pill? The prospect is certainly enticing, isn't it? But before we delve into that, let's take a moment to understand where we currently stand. The primary treatment for OSA today involves a device known as a continuous positive airway pressure or Cpap machine. This device works by pushing a steady stream of air through a mask that patients wear as they sleep, helping to keep their airways open. Sounds simple and effective, right? Well, not quite. Despite its effectiveness, the Cpap machine comes with its share of challenges. It can be cumbersome, uncomfortable, and even intimidating for some patients. The noise it generates can disrupt sleep, and for many, the inconvenience of lugging it around can be a deterrent. In fact, studies indicate that a significant number of patients end up abandoning their Cpap treatment due to these hindrances. Then, there are lifestyle changes that doctors often recommend. These include weight loss, quitting smoking, and avoiding alcohol and certain medications. But as we all know, lifestyle changes are easier said than done. They require a great deal of commitment and discipline, and even then, they may not be enough to fully manage the condition. The need for a more convenient and effective solution is clear. We are in desperate need of a treatment that is not only effective in managing OSA, but is also easy for patients to adhere to. A method that does not require patients to strap on a device every night or overhaul their lifestyle dramatically. This is where the idea of a pill for OSA becomes so compelling. A pill that could potentially manage the condition without the need for machines or lifestyle changes. A pill that could be easily incorporated into a person's daily routine, just like any other medication. Imagine the relief of millions of OSA sufferers if there was a pill that could treat this condition. The good news is, this isn't just a pipe dream. The prospect of a medication to treat OSA is getting closer. But more on that in the next scene. A recent study offers a glimmer of hope for such a medication. Let's dive in and explore this promising research. In an effort to find a potential pharmacological solution for obstructive sleep apnea, OSA, researchers turned to an expansive data resource, the National Hospital Ambulatory Medical Care Survey. This survey is a goldmine of information, recording the intricate details of medical care across emergency departments in the United States. To clarify, the focus of this research was to identify the frequency of medications with pharmacogenetic recommendations being used in these emergency departments. Now you might be wondering, what does pharmacogenetics have to do with this? Well, pharmacogenetics is the study of how a person's genetic makeup can impact their response to drugs. This field of study has the potential to revolutionize the way we prescribe medications by tailoring the drug and dosage to each patient's unique genetic profile. Back to the study. The researchers meticulously sifted through the data and discovered that just over 18% of emergency department visits involved the use of medications with Clinical Pharmacogenetics Implementation Consortium, or CPIC, recommendations. The most common medication with a CPIC recommendation was tramadol, a medication primarily used to treat moderate to severe pain. But the study didn't stop there. It also highlighted some rather interesting demographic trends. Visits involving CPIC medications had higher proportions of female patients, patients with private insurance or self-pay, and patients who were discharged from the emergency department. On the flip side, they had lower proportions of patients with Medicare and Medicaid. So, what does all of this mean? Well, this study underscores the potential impact of pharmacogenetic guidance on individualized patient care in the emergency department. It suggests that pharmacogenetics could play a crucial role in prescribing the most effective medications for each patient, potentially improving outcomes and reducing adverse drug reactions. In the context of OSA, this could mean identifying a medication that is effective for treating this condition, based on an individual's unique genetic profile. And while we are still in the early stages of understanding and implementing pharmacogenetics in clinical practice, this study serves as a beacon, illuminating the path towards more personalized and effective treatments for conditions like OSA. The results of this study suggest that a pharmacogenetically guided medication could be a game changer in the treatment of OSA. Stay tuned as we delve deeper into the potential medication that could revolutionize OSA treatment in our next segment. So, what could this prospective medication look like? Let's delve into that. Imagine a medication tailored to treat obstructive sleep apnea, or OSA, that's designed with a patient's unique genetic makeup in mind. It's a concept rooted in pharmacogenetics, the study of how genes influence an individual's response to drugs. This potential medication wouldn't be a one-size-fits-all solution. Instead, it would be a customized treatment, shaped by the individual's genetic profile to maximize effectiveness and minimize unwanted side effects. Now, let's consider the implications of the study's findings. Remember, the study found that nearly 1 in 5 emergency department visits involved the use of medications with Clinical Pharmacogenetics Implementation Consortium, or CPIC, recommendations. This suggests that pharmacogenetically guided medications are already playing a significant role in patient care. So, how could this apply to OSA treatment? Well, think of a medication that could target the specific genetic factors contributing to a patient's OSA. By honing in on these factors, the medication could potentially address the root cause of the condition rather than just managing the symptoms. This could mean more effective treatment, improved patient outcomes, and perhaps even a reduction in the need for more invasive interventions like surgery. In addition, the study found that visits involving CPIC medications had higher proportions of female patients and patients with private insurance or self-pay. This might suggest that a pharmacogenetically guided OSA medication could be particularly beneficial for these groups. However, while the prospect of such a medication is promising, we must remember that we're still in the early stages of this research. The science of pharmacogenetics is complex and continually evolving. There are still many unknowns and challenges to overcome before a pharmacogenetically guided medication for OSA can become a reality. The prospect of such a medication is indeed exciting, but more research is needed to turn this potential into reality. What does this study mean for the future of OSA treatment? Well, the implications are certainly exciting. This research suggests a paradigm shift in the way we approach obstructive sleep apnea, or OSA. Rather than relying solely on devices and lifestyle modifications, we may be on the cusp of introducing pharmacological interventions into our arsenal. The potential of a medication specifically designed to treat OSA could revolutionize the way we manage this common sleep disorder. Imagine, instead of a cumbersome Cpap machine or an invasive surgical procedure, a simple pill could help millions of people achieve a good night's sleep. This is the future that this research envisions. However, it's critical to temper our optimism with the understanding that this is just the beginning. The study's findings are promising, yes, but they are preliminary. The journey from a potential medication to a market-ready drug is a long and complex one, fraught with rigorous testing, clinical trials, and regulatory approvals. Therefore, it's essential that we continue to support and invest in further studies to confirm these findings. Clinical trials, in particular, will play a pivotal role in this process. These trials will not only validate the efficacy of the potential medication, but also ensure its safety for widespread use. Moreover, these trials will help us understand the nuances of the medication's effects. For instance, which patients will benefit the most from this treatment? Are there any side effects we need to be aware of? These are the questions that can only be answered through comprehensive clinical trials. In conclusion, while the road to a medication for OSA is still a long one, this study marks a significant step forward. It opens the door to a whole new avenue of treatment possibilities, and that is indeed something to be optimistic about. While we await more research, this study offers a promising glimpse into a future where OSA can be effectively managed with a simple pill. So, before we conclude, Let's take a quick moment to reiterate the main points we've dissected today. Obstructive sleep apnea, or OSA, is a prevalent issue facing a significant number of people worldwide. Currently, the treatments available have certain limitations. They range from mechanical devices that can be uncomfortable and inconvenient to surgical options, which are invasive in nature. We've dived into an enlightening study that shows close to 20% of emergency department visits involving medications come with clinical pharmacogenetics implementation consortium recommendations. A regularly used medication, tramadol, with a CPIC recommendation, is often employed, signifying the potential for pharmacogenetic guidance in the personalized care of patients. This knowledge brings us to the enticing prospect of a medication guided by pharmacogenetics that could revolutionize the way we approach OSA treatment. The future could witness a significant shift from bulky devices and surgical methods to a straightforward pill. Our hope for the future is that this potential pill could transform the lives of millions of OSA sufferers globally. As we wrap up, we would like to remind you about the importance of sharing this important information. Do spread the word about our channel and the key insights we discussed today by liking, subscribing, and sharing this video. We greatly appreciate your support in raising awareness about OSA and the potential advancements in its treatment. Until next time, stay informed and stay healthy.